to our session this afternoon. We are here to talk about from data to decisions, and specifically building integrated systems for climate and for health. Before I get started, for those who are in the room, ICT4D brings together people from so many different sectors. I'm curious whether, just from a show of hands, whether climate impacts are relevant to your work, to your organization's work. Just does climate impact and address? Okay, good. Thank you. Is your organization currently using climate or weather-related data in any way? Just a show of hands again. Okay, excellent. A little fewer, but some organizations are using it. Would love to meet you after to learn more about how. And would you say then, just again, show of hands, would you say that climate information is integrated into operational decision-making in your organization? Any show of hands there? One from this, for those online who can't see. One. Okay. Thank you for sharing that. All right. We'll get into that a little bit, but just to introduce ourselves, my name is Tali. I'm the director of our Global Communities program at DataKind. DataKind is a global nonprofit organization focused on closing the digital technology gap in the social sector. So we collaborate actually with very, truly highly skilled expert individuals as well as impactful organizations to develop sector-facing products and digital public goods. And the goal is there to advance our mutual commitment to building a more just world through responsible and ethical use of data. My colleague with me today is Justice.
Hi, everyone. My name is Justice Ogando, Executive Director of Spectrum Africa Climate Health Initiative based here in Kenya. And we work along the continuum of science, policy, and practice to build an ecosystem driven by the mission of building a resilient society that cares, prepares, and protects, and a vision to achieve sustainable climate positive growth through health equity, energy security, and environmental justice. Thank you.
We're going to get started this was meant to be, by the way, a straight up presentation, but actually I think we're going to convert this into a bit more of a conversation. And I'm going to start with something that's hopefully really not at all controversial, which is to say that climate change is a current and escalating health crisis. It is really expanding the diverse variability and patterns that we're seeing in diseases. But I want to start with maybe immediately asking you, Justice, we know this is now a statement and hopefully not really controverted. How should health systems start to respond differently, given that it is now known to be a health crisis?
Yeah, thank you, Tali. So I think health system has grown from the organic regime in which we were addressing disease problems in a different way, in a different time scale. But what is emerging with climate is the increasing range and complexity of these patterns that requires a different approach. Our health systems have been built around health facility, but the problems occur in the community. And so this infrastructure and the structure and the people that are needed to bridge that gap need to be equipped to be able to intervene at community level. Aspects like promotive and preventive health need to be amplified differently because majority of the people who are affected by climate effects have most likely poor care-seeking behavior. And to reach them, we need a new way of thinking. One, you may not be able to achieve much success preaching to them about their healthcare risk factors when they don't have livelihoods. So you must tackle livelihoods and health in concurrence. because they rarely will listen to you on health matters when their animals were destroyed by drought, their environment was damaged by flooding, and they don't have agricultural outputs, because there's more stress in that. Mental health is an issue out there that you would rather change the approach of expecting them to come to the facility and now go out and interact with them at the community, because the main area where the action is, where climate issues and impacts are happening, is at community level. And that thinking needs to be pervasive across the entire sector to ensure that the frontline health workers are able to reach these people where they are. So if they are cut off by flooding, for instance, there's no way they'll make it to the facility. But the people who are supposed to reach them, are the community health promoters, are not equipped to be able to cross over to get to them. And that is the significant gap that we need to address when it comes to the climate health nexus, to reorganize the health system to deliver response at community level. Thank you.
Thanks, Justice. Let's ground this in a specific location, maybe, because we're often talking general, at a general level. You've been working for a long time in Kajiado County. Can you tell us a little bit about what's happening in Kajiado County right now at the nexus of climate and health?
Yeah, so before we go into Kajiado, I think it would also be good to highlight something that happened with the recent flooding in Kenya. I think that was 2 years ago, 2024, and it was emblazoned on the media. A pregnant woman swam across a crocodile-infected river in Tana River district. A distance of, she covered a distance of close to 8 or 10 kilometers to get to a facility to deliver. And you know Tana River has crocodiles. She was, I think, just Google, you'll find it on Daily Nation. A woman swam across a river to go and deliver at a facility because of flooding. In the same country, you'll find suicide cases increasing. If somebody's livestock is wiped out, and they're in a pastoral community where your status as a man is defined by the number of, the herd of cattle you own, you will not feel like you belong. And the chances of suicide increases because of drought. Sometimes you find the only mechanisms to circumvent that social stigma is to marry off your young girl child to be able to replenish the stock of cattle. So there are so many climate-mediated effects that are undocumented from a health point of view. So if you go in with the mindset of addressing health alone, you're likely to miss so many of these nuances that drive communities from a cultural perspective. And so in a Maasai community, cattle is important to the men, but drought wipes out majority of this. In the same community of pastoralists, the beast of the burden is the donkey. But during drought, when they die, the beast of the burden becomes the historically disadvantaged gender, which is the women. They are the ones who have to now fetch water long distances. They have to fend for the families, look for food. And so the connectedness, that's what I'm trying to say. There is so much connectedness that if you just go on a single stream of thinking around health, you will miss all these nuances that are connected from a socio-cultural aspect. And that's why I'm saying, if you can address the livelihoods alongside, in concurrence with health, then you are likely to have a leapfrog better than when you go in for health alone. Thank you.
Thank you, Justice. We're talking a lot about the integrated nature of the climate impact on health, but we have to start somewhere. And at the moment, climate information, like I asked earlier, climate data is not, for many of you as well, when I asked the question, we had very few hands that went up around how regularly is climate data actually being integrated into operational decision-making in your organizations. In the health sector, it's the same thing. It exists, it is not integrated in, let alone bringing in information and data from other sectors. So where do we start? When it comes to thinking about this, the challenge isn't actually the data itself. It is no longer anymore a question about whether we need climate data for health. It is almost as irrefutable the fact that climate is impacting health outcomes, but rather how can it be translated into action that better supports decision-making at the most impactful levels. So we'll start with just thinking about how do we bring that data into systems. And we'll start with climate data, although I know that we need to talk about actually the integration of different sectors bringing their information together. So let me start with, again, another question to you there, Justice. So if we are able to, we know that we need climate data for health, but what does that integration potentially unlock if we're able to bring climate data into routine operational decision-making in health?
Yeah, complex, complex scenario. But one of the things, like I've given you the scenario in the earlier question that Ali asked, I think when you take that connected approach, you're able to build that ecosystem view that would be able to address multiple compounding factors, because it's not a single stream response. And we cannot answer everything with the data that we are collecting, but at least to just have that ecosystem perspective to be able to now assign specific interventions based on your capacity, your organizational capacity, depending on who is involved in the space. And one of those areas where I see interesting dynamics is when you look at the way health data, climate data is framed, it actually helps with community level scenario planning. And most often than not, the scenario planning has implications in health indicators of interest. So agriculture sector makes effective use of this data, but that has a touch point on nutrition and on maternal newborn health. And so health itself is not able to make effective use of the data they get from climate per se, because of the way it is structured. Climate, I've interacted with climate data from Kenya Met, and the two variables of interest was precipitation, the rainfall, and heat. But they also collect on air quality, but nobody's using it as yet. It's just there. But they collect good data, quality data. I'm talking of data that can cascade down to a radius, a square footage of 2 by 2 kilometers. At the sub-county level, they can tell you all those on a weekly basis and the rainfall pattern. However, the health actors are not able to leverage that data because it's not in a format way that can help drive decision. But the agriculture people are able to leverage that data for their own activities. So I think the One Health approach is able to help build multiple layers that can open up the mindset of health actors differently to be able to also create connection, because health thrives more on attribution indicator, which is difficult to define when you bring climate science data to them. And that ecosystem, One Health approach is able to help us achieve amplified impact, as opposed to just going to dig through as an health advocate or health warrior, looking for what speaks to you. You will not succeed because the way the data is organized, it's not speaking to their needs as health sector, the way climate science data is organized. So I think that balance helps when you bring other sectors into the mix. It opens up, including aspects like social welfare. When we are building safety nets, the social welfare is able to make use of the climate data from that point of view. But facilities, health facilities would struggle. And I think they would benefit from that complementarity of working as a cohesive team to unlock opportunities that can address specific health indicators of interest like nutrition, which I've talked to you about. And when you cascade this further to specific cohorts, you find maternal newborn child health thrives heavily on the nutrition indicators, the child feeding program, the early childhood development issues. So they can then be able to work together as One Health. Thank you.
Thanks, Justice. I think just to add to that, coming out of the recent World Health Assembly that took place earlier this week, or is actually still taking place, there's also there was a coordinated effort from organizations that have been working for a number of years on strengthening community-based health systems in recognizing the interconnectedness, of course, of this, and the idea to bring climate data at a localized scale that can actually be operationalized at that scale was, of course, highlighted as a need. And the advocacy was around things like being able to improve just routine surveillance. As Justice said earlier, that first case of you name your communicable disease. Right now in the news, we are seeing Ebola and very concerning rates of Ebola spread. That first case happened in the community, not in the health facility. It was the community health worker who identified it, who alerted, who reported, and protected the community. There is a sense that the resilience, no matter how you think about resilience, if you don't have a strong and resilient community health system, which has supplied, which is supported, which has the right information and actionable intelligence, it's not really going to be able to respond. Right now, it's just seen as quite passive, as a data generator activity.
Let me just also add on to that. As she was talking, something crossed my mind. It's troubled me for almost 2 years, but I've been thinking through how to connect community resilience for the empowerment with health facility in the area of nutrition, health, and agriculture. So take a case in point, drought happens. And the lands in arid counties, the soil nutrients get run off by floods and droughts when they happen asynchronously. Flooding comes, washes off, drought comes, destroys the structure of the soil. So what you find then is the soil nutrients are run off. What do people do? They try to optimize the soil through synthetic fertilizers. These synthetic fertilizers are also greenhouse gas emitters. And the challenge we haven't connected, which is what I'm hoping science will work with community and policy, is for the food crop that are propagated through these significantly heavy chemicals, we have not looked at the indications from the health side in terms of gastroinfections and all the other associated issues that come up from consuming such kind of food crop. We have a challenge along the border with Tanzania, which is porous, where entry of products like Spiro 100, which has been banned in EU, and it's used for propagating tomatoes because people need tomatoes that can mature in greenhouse within 21 days to take to the market. But now when they do that, they don't care about population health. And so the health sector, if they were very conscious, they could look at how to showcase how many cases are we seeing from this emerging evidence when people are doing what consciously is right. We want to improve food productivity because the soil has been damaged by drought, flooding, repeated drought and flooding, but they are not well informed that too much chemical application actually degrades the soil, but also transmits into human health challenges. So there's a region where many cases of cancers have been coming up along the border with TZ, but we haven't connected the dots. And that's why I'm saying it's a connected process that requires the ecosystem to work together.
That actually brings me really nicely to the fact that we have to call out there are structural barriers. Why is that integration so hard? Let's just name it. And right up there is actually, let's talk about the funding inequity. So you mentioned the research that helps to make these correlations, that helps to make the connections. Now, first of all, at the moment, we have, there is a study out and it's in the Lancet, and I have the links here, which if these slides are circulated, you can have a look at. But less than 4% of global climate research funding actually is directed to Africa, to the continent. Of that, I mean, of course, much of that really remains concentrated in the north, and where the research institutions are more northern and western, globally speaking. But even off that 4%, it's an even tinier fraction when you think about how much is actually invested in the climate and health research that is driven by not driven by, you can have there is more climate research being driven by epidemiological burden, but is there enough being driven by understanding of what communities themselves are exposed to in terms of risk? There's also a lack of the granularity of information. when you don't have localized actionable insights, it makes it very difficult to take localized action, which is where systems in general are most responsive. National level data, we see a lot of work that is being done now about bringing, looking at climate research at national level, but it is insufficient for operational decisions at the localized level. And then do want to call out the fact that we are still dealing, it was mentioned in a couple of panels earlier as well, that health systems are still coming up with standardized data exchange, common data standards. It's very different to the climate data landscape. Really structural differences. Climate data and climate systems are quite automated. They have good standards. They are standardized in the first place. Whereas our human health systems, there are a lot of human processes, and there's the question of interoperability, of course, but we can't forget the complex role of privacy and governance as well. So I just want to call out those structural barriers that do exist, but we can still move past it now. Those barriers aren't quite the same barriers, or the nature of them has changed given how also technology has changed. So how do we now move from data collection, which we have ongoing, it can be improved, yes, but we've been working with imperfect data for a long time. How can we go now from that data that we collect to action and decision support? Justice?
Yeah, so I think the way the data systems are organized is they work for the individual sectors for which they were established. So health data works for health data. Climate science data works for climate science data. In the integration, I think there is need for some middleware that can bring some sanity into this context. You find a frontline health worker will not be able to make conscious decision based on the layers of climate science data. Sometimes the epidemiology and public health data is collected, but in health sector, you find a lot of nice to have data is collected. That sometimes it's difficult to know what are we making effective use of this data. Probably it was because we needed to complete a reporting requirement. Sometimes the data is used for planning the next strategic plan rather than immediate action. So when you bring in the climate and health science nexus, you want data that can help health actors to do immediate action. Because climate is a real-time occurrence, we cannot wait for time to happen in future. We need to take action immediately, and that is the gap. So this ecosystem is very important, a decision support system that can give them targeted intervention. And this is the reality that frontline health workers need to be able to achieve some of the success we are aspiring for. From a health point of view, at least from an example of Kenya, the Ministry of Health has aggregated the data systems through an authority called the Digital Health Authority. However, it's still not bringing in the climate side of things. It's just organizing the space for all the individual data systems within health, the disease programs and all that, which will work for health. But we are lacking the climate science part of it. So the cross-sectoral coordination still feels shaky because they are responsive to their individual line ministries, and maybe some policy regime will come in to try and bring that, or some coordination mechanism will be created to be able to bring that integration across both sectors and make it easier for health actors, frontline health actors, to be able to make effective use. The other aspect that I foresee is some of the data collected is rolled up through these complex structures that involves DHIS up to national level, but there is no reverse relay that will help people who collected it to appreciate what comes out of it. So they do it more as a routine, not with a curious mind to query if there are any parameters that we need to change. They've been collecting the IDSR, the disease surveillance data, for the longest, but nobody has queried whether all the indicators we are collecting is relevant for us and in what way, and are we even making decision out of it? So sometimes it's just a reporting requirement. Even if you build a digital solution, that embedded complexity and challenge still exists. And we will just be creating a complex automated ecosystem. Yeah.
Thanks, Justice. And then just looking ahead then, absolutely, we know that we are going towards, and I'm going to talk a little bit about how DataKind, Spectrum Africa, and others are working towards this and making this a bit of a reality, grounding it in a real example. But just let me ask you, why is the timing good now? What is the opportunity that we have? You know, I think Kenya specifically presents a unique opportunity for us to do this and take data and integrate it and actually start thinking about decision support.
Thank you, Tali. The reality is our devolved government system, to this extent, our devolved government system provides a quick win because modeling climate health scenarios at national level is challenging because contexts vary at sub-national level. With the devolved government system, then we are interacting, DataKind and Spectrum and other partners, we are interacting at county level. We are building context-dependent infrastructure that can then be rolled back up to national level and can be replicated across countries that present with unique variabilities and socioeconomic aspects. That way, we are riding within an established structural system. It makes it very easy, especially that we are working on Climate Health Pulse. We see that Kenya has more than half of the counties are ASOL counties. So if there are unique attributes, it will be easier to replicate within the same structures through the Council of Governors Secretariat that manages the county government affairs. So I think the structure works in favor. And then the policy regime has also been changing quite rapidly and gives credence to the Health National Adaptation Plans, which the Ministry of Health is also driving right now. We've just completed the development of the Climate Resilient Infrastructure Health Facility Guidelines, as well as the Green Healthcare Guidelines in partnership with UNICEF and the Netherlands Embassy. And those are giving us the opportunity for dissemination, cascading through this structure. So policy is working, practice is also connecting, and the infrastructure is also being brought on board. Thank you.
Yeah, thank you. And again, I'll just highlight something, bringing back to you from the World Health Assembly as well, that the Kenyan government has made an incredible effort to help reduce duplication of efforts across frontline NGOs that are working on health, bring them together, and really start to create a common agenda around what it means to have a resilient frontline health sector. So I think coming on what you said there, then, Justice, that's exactly what our consortium is doing. DataKind, of course, is working with Spectrum Africa, is working with Jacaranda Health that supports pregnant women and new mothers around Kenya, Kajiado County Ministry of Health, and we're setting up the foundation for this co-developed solution. So I'm going to dive in now to talking a little bit about what, Justice, you referenced, which is Climate Health Pulse. Okay. So Climate Health Pulse, or PULSE for short, is an emerging decision support platform that really does integrate climate forecasts, health system data, as well as community insights for actionable intelligence. It is not just about one data source or even these 3 data sources. It is about being able to layer on multiple sources of data. Right now, sure, it shows health systems data, it shows you the community insights and the climate forecast data. But we know, just like we spent the first 20 minutes talking about the integration, there is a lot more that needs to come together. And again, in terms of opportunity, particularly in the area and the partnership we have with Kajiado County, the leadership the county has taken with the One Health Working Group presents quite the opportunity to see how we can bring in that cross-sector collaboration to bring about climate-based intelligence. Now, on this tool, though, it's a map-based tool. It shows you Kajiado County. It allows you to visualize trends at not only at the county level, but you really get to drill down to the sub-county level as well as to the ward level. You can identify cases of whatever indicator is being tracked by the Ministry of Health. Malaria rates, the rates of stillborn children, neonatal morbidities that we care about, maternal mortality and morbidity rates. The Kenyan government is tracking on so many different health indicators, but you can actually start to drill down and look at each ward and think about what might be the relationship between the surrounding areas. It also supports looking at heat exposure monitoring, rainfall. Right now, these are the 2 main climate indicators that are on the tool. But what else? We know that air quality, particularly around Nairobi County and the different wards surrounding Nairobi County, are impacted. So how can we start to bring some of those on? In terms of capabilities, in addition to being able to visualize trends at county and sub-county level, you can identify those climate and health correlations. You can support the monitoring of climate events, climate data like heat exposure and heat events or rainfall, flooding. And you can anticipate the risks actually before they become, before the outcomes occur, because there's even forecasting included in the decision support system. There is a meaningful opportunity here. This is a bit different, but there is really an opportunity here to institutionally integrate community insights. So many of you here will know the important work that Jacaranda Health does. I want to really give a shout out to them and as our partners here. They work at scale to improve maternal and newborn health, reaching over 3 million mothers in Kenya and training over 10,700 care providers. They partner in 23 counties in Kenya of the 29, I believe. 27? 47 counties? Oh, never mind. Recently, though, Jacaranda published findings on what data from their Prompts platform, which is an SMS-based platform, tells us about how millions of Kenyan mothers experience extreme heat. For pregnant women, the impact is immediate and biologically relevant. I'll just call out a few things. For every 1 degree Celsius increase, it is associated with 4 to 5% higher odds of preterm birth. It's an elevated risk of stillbirth, low birth weight, and congenital heart disease. Mothers face increased risk of gestational diabetes, hypertensive disorders, miscarriage, all driven by things like dehydration and cardiovascular strain. And it even gets even more complex. Now, on Jacaranda's journey into that research started with using our Pulse platform, where we analyzed a mother's questions in relations to extreme heat and found an uptick in the kinds of danger signs being reported during heat events. For instance, by looking at climate data, looking at the KHIS data, and Prompts data together, we found that general questions about pregnancy and newborns and questions related to things like intercourse, pain, swelling, urinary tract infections, all of that increased at higher temperatures. The effect is modest, but statistically significant. When temperatures climb above 30 degrees, we see almost a 70% spike in edema concerns coming from mothers, and a 23% increase in labor queries. I think this starts to give you a sense of you can look at system collected data, the health system is collecting data, but really you can also start to listen to community voices. This is just one way of integrating community insights into a platform, and there are others. How do we start to combine them and start to think about what is the differentiated approach needed and response needed in order to meet our collective goals? Understanding the data is only one piece of the puzzle. I'm going to link back again to what Justice was saying. What do you then do with data insights and forecasts? With aspects of the health system, which aspects of the health system are most responsive and can take action? What decisions can actually be made, and how can that be, who gets to make them? This is all something that is great to have a nice dashboard and insights, but what does that empower who to do? And that is what actually the next phase of work is focused on. Maybe you all also have some insight here. You've been working in these sectors for a long time. You have a lot of experience. And we want to know if you're willing to share your experience. We want to move beyond this prototype into thinking about how do we get to this integrated solution. Yes, we need to think about how things like pilots really end up scaling, and that is a conversation that needs to be had. But first of all, before we even get there, can we talk about realistically, what do these insights actually unlock? Building climate resilient health systems requires collaboration. We are starting to develop partnerships around community, climate health data, integration, modeling even. The forecasts are not, giving you 100% insight into what's going to happen next. There's a tremendous level of uncertainty that we have to deal with and understand. So how are you dealing with this? If you're working at the intersection of climate and a program at health, climate and health, we would love to connect. So please consider joining our community. You can click in here. You can take a screenshot of this QR code. There are a number of different ways in which you could potentially contribute or suggest ways in which we haven't even considered. But that's what I'll leave you with here. I know it's a little, we're checking on time. I think we're good. And I can pause here for questions, but otherwise, from Justice and myself, thank you for being here. Are there any questions at all?
Thank you for the insightful conversation. I'm very curious about, towards the tail end of your presentation, what are we thinking about use cases? Because I'm very curious at where is the thinking at? I understand it's an evolving conversation, but I love that, climate data is structured differently, health data is structured differently. But if we solve the technical problem, which has its own challenges, yeah, I find it hard. Like if Jacaranda is getting more of this, if Jacaranda knows that there's going to be a heat wave, I can imagine they'll send an extra SMS. Like that seems like the closest use case to the examples that you've brought in. But what are other actual operational decisions that you're thinking for programming? I understand. I'm curious about decision support that are more short term and that can affect the operations of both organizations that work on the health side and on the climate side to use these shared insights. Curious where the thinking is at. Thank you.
A quick use case that comes to mind, because I'm from a supply chain background in a previous life, is health system preparedness. Because not everything should be an emergency. They're actually valid emergencies, but there are those which is just poor planning. So you saw the map of Kajiado County. It can drill down, the platform can drill down up to facility level. We've populated the facility level by the including number of beds and cots for children, so that if incidences happen within that domicile of the facility, you can make advanced decisions for planning purposes, especially on supply chain logistics. If you see evidence that there's a forecasted heat wave coming and the health indicators of interest that the mothers are self-reporting on are known, the national supply chain system should resource the facility nearer, or quick decisions should be made about referrals. Instead of waiting to be overwhelmed, patients showing up at a level 2. Kenya's health system is cascaded into levels. So level 2 is dispensary, level 6 is the national referral. So mostly what you'll find out in the counties would be level 2, 3, which is dispensary and health center. And some of them don't have capacity for admission. Some don't offer maternity services admission. So you need to, as a policymaker, county level, that is what this tool should help you with. Quick planning, that we know heat wave is coming. The following counties are known to be prone to this kind of thing. So we need to be prepared. If we know the scales of heat waves that we're expecting from the forecast, we need to know how to prepare the referral cases, resource them, give them the right health products and technologies that they need. Like she mentioned, during drought, during high heat, there's ODIMA. There are cases where you find drought is severe. We don't need to be thinking last minute about zinc ORS, the rehydration, which should always be available if we know the cohort we are serving. So that's the quick use case. Policy planning, supply chain planning, referral across facilities to be able to reduce cases of fatalities that are avoidable.
Yeah, and I'll just add to that, like use cases, there's no shortage of use cases, and it depends on who. This is a consortium of I mentioned, the 4 actors, and you can imagine from the Ministry of Health, the Ministry of Health itself has identified, we're working Kajiado County, there is an epidemiological disease burden that's specific to Kajiado County. That is driving use cases that's coming out from our county level partners. There are concerns. It's also not immediately clear what the exact relationship is between that disease, and how exactly the climate pattern is impacting. So what that's driving is a sort of bottom-up climate research agenda. So there's a use case that's driving more, how do we understand better what is the linkage and the relationship between climate factors and this and the disease burden that we're witnessing here, and the change and the variability in those disease patterns that's being impacted by climate change. So there's the county level perspective, and then mentioned the community level insights driving use cases as well. And I think the whole ambition of this is to enable all the different actors to pursue the use case of interest. You can look at it from the disaster management has these terms when it comes to disaster management planning: gray sky and blue sky. Yes, there is something in emergency that you need to do, but most of it is planning for what happens in the scenario of. And a lot of the work of the health systems, as we understand it right now, is really just thinking about, how do you make up the next budget? How do you do, what is going to be the supply chain? What supplies is it that the facilities need, the community health workers need? And it is not quite as data-driven as you would think it is. And this is where, again, using a tool like this as an active decision support system is where where this ambition of this initiative is. Thank you.
May I also add, further afield, we had already mooted this idea at the ideation stage for this platform. We also want to challenge the scientific community. Maybe they're also researching wrong priorities. And we want to trigger them to rethink, are we actually tracking the right hypothesis or agenda in our research if what we are seeing is emerging differently, so that they can reprioritize to matters of significant importance, which are context dependent to a county? Because as it is, it's from a disease point of view that most of the research work is done. But now when we layer climate, it needs to take us back to the drawing board. Are we actually addressing the right hypothesis or the right agenda? Because we need those scientific outputs to influence policy, to shape the policy narrative at national level. Thank you. Should I be asking if there's another question? Any other question, even online? Okay.
All right. Well, then we won't keep you, but thank you again for being here and for joining us for this conversation. We really would like to ask you lots of questions, so we'll end early so that we can come find you. And especially to those of you who mentioned you are using climate and weather forecast data in your day-to-day work, we'd love to know more about how you're doing that. And with that, thank you. We'll close the session.